Magnesium is involved in over 300 enzymatic reactions in the human body. It sits at the intersection of energy production, protein synthesis, DNA repair, muscle contraction, nerve transmission, and blood pressure regulation. It's the fourth most abundant mineral in your body. And yet research consistently shows that 60 to 80% of adults in developed countries don't get enough of it. 1 mineral. 300 reactions. Most people deficient. What makes magnesium uniquely important is the breadth of its clinical applications. Randomized controlled trials support its use for sleep improvement, anxiety reduction, blood pressure management, blood sugar control, muscle cramp prevention, migraine prophylaxis, and depression symptom reduction. Most people know it vaguely as the sleep mineral. The research tells a much wider story. In this video, we are going to see the full picture of what magnesium does, when it works, and which form to use. The magnesium research base is extensive and spans multiple specialties. The landmark Physiological Reviews paper by de Barrage catalogued its functions across all major systems. Randomized trials have confirmed specific clinical benefits for sleep, depression, type 2 diabetes, and cardiovascular risk. The research is unusually consistent. Magnesium deficiency predicts pathology, and correction reduces it. The challenge has been translation into clinical practice. The prevailing assumption is that if you eat a reasonably varied diet, you're probably getting enough magnesium. The research on modern agricultural practices suggests otherwise. Crop yields have been dramatically increased through industrial farming, but at the cost of mineral content. Studies comparing food grown in 1950 versus today show up to 40% reductions in magnesium content in vegetables, meaning you'd have to eat more vegetables just to get the same amount of magnesium as previous generations. Magnesium deficiency has a uniquely insidious pattern because it mimics other conditions. It looks like anxiety, it looks like sleep problems, it looks like fatigue, it looks like muscle tension. Most patients with these complaints receive treatments for the surface symptoms without anyone checking the underlying magnesium status. And because blood testing misses most deficiency cases, the cycle perpetuates. Magnesium deficiency is the nutritional disorder most likely to be treated as 5 separate medical problems. The magnesium supplement landscape is confusing because it contains radically different products marketed under the same name. Magnesium oxide, the most commonly sold form, has approximately 4% bioavailability. You're essentially buying chalk. Magnesium glycinate absorbs well and is gentle on digestion. Magnesium malate supports energy. Magnesium threonate penetrates the brain. The form determines the outcome entirely. Choosing wrongly produces neither the claimed benefit nor the documented clinical effects. A 2017 open-label trial published in PLOS One examined magnesium supplementation for depression. 126 adults with mild to moderate depression supplemented with 248 milligrams of elemental magnesium daily for 6 weeks. The result: significant improvements in depression scores, comparable in magnitude to antidepressant effects reported in many pharmaceutical trials. The effect appeared within 2 weeks, suggesting rapid neurochemical response. The mechanism involves magnesium's modulation of NMDA receptors and serotonin synthesis. For type 2 diabetes and blood sugar regulation, magnesium's role is mechanistically clear and clinically validated. Insulin secretion and glucose transport both require magnesium as a cofactor. Meta-analyses show that every 100 milligrams per day increase in dietary magnesium is associated with a 15% reduction in type 2 diabetes risk. And in people with diabetes, magnesium supplementation improves fasting glucose and insulin sensitivity measurably within 12 weeks. Magnesium's clinical benefit area span remarkably diverse physiological systems. This reflects its role as a cofactor in hundreds of enzymatic pathways rather than a single mechanism. The research is consistent. Where deficiency exists, correction produces measurable benefit across multiple systems simultaneously. Research shows this pattern is more consistent across populations than previously understood. Studies find these effects are measurable and reproducible across independent research groups. Magnesium forms differ not just in bioavailability but in tissue distribution, where each form ends up in your body. This makes form selection by health goal genuinely important, not just marketing nuance. Research shows this pattern is more consistent across populations than previously understood. Studies find these effects are measurable and reproducible across independent research groups. The evidence here is robust, replicated, and directly relevant to your daily health choices. The magnesium optimization framework starts with dietary foundation, adds targeted supplementation for specific goals, and manages absorption. On the food side, the richest sources are dark leafy greens, pumpkin seeds, legumes, dark chocolate, and avocado. On the supplement side, form selection by goal is critical. And on the absorption side, knowing what blocks magnesium, alcohol, excess calcium, certain medications, prevents you from supplementing without benefit. The timeline for magnesium repletion varies by symptom. Sleep improvements tend to appear fastest, within 1 to 2 weeks of adequate magnesium intake. Mood and anxiety shifts typically emerge within 2 to 4 weeks. Blood pressure and blood sugar effects require 6 to 12 weeks of sustained adequate intake. Bone magnesium reserve replenishment, the largest compartment, takes months. Tracking symptoms by category helps assess whether the form and dose are adequate. Here is the practical daily magnesium protocol. Eat at least 1 concentrated magnesium food source daily. 1 ounce of pumpkin seeds delivers 37% of the RDA. For supplementation, magnesium glycinate at 300 to 400 milligrams before bed is the most versatile starting point for most adults. This addresses sleep, anxiety, and general deficiency simultaneously while being well tolerated on the digestive system. The goal-based selection of magnesium form makes the difference between a supplement that works and one that doesn't. If you're using it for a cognitive goal, threonate is the only form with documented brain-specific effects. If fatigue and muscle function are your primary concerns, malate's involvement in the Krebs cycle energy pathway makes it the most mechanistically appropriate choice. If you're pregnant, cramp-prone, or managing PMS, glycinate or citrate are the best tolerated and most general options. Magnesium is involved in more biological processes than almost any other mineral, yet it's deficient in the majority of adults in developed countries. The consequences are wide: poor sleep, anxiety, high blood pressure, blood sugar dysregulation, muscle problems, and accelerated aging. The solution is specific, not generic magnesium, but the right form for your goal, in adequate doses, consistently. The research has laid this out clearly. It just needs to be applied. 300 enzymatic reactions. 1 mineral. And the majority of people chronically short of it. Understanding magnesium is one of the highest leverage steps anyone can take in their nutritional health, not because it's trendy, but because the biology and the clinical evidence are genuinely compelling. Research shows this pattern is more consistent across populations than previously understood. Studies find these effects are measurable and reproducible across independent research groups.